Welcome to the Slop Temple. We pray this video helps.
You start by assessing what's wrong and preparing the conditions. First, reduce glare and set 300-500 lux lighting so you can see details. This reveals issues masked by poor light. Next, test focus at 30-40 cm to identify near vision strain, and write down blurriness, pain, or double vision so you know what to fix. Once done, gather simple tools: a mirror, clean cloth, screen settings, and a timer to guide the next steps. You now run proven, targeted exercises to retrain muscles and reduce strain. Start with palming for 1 to 2 minutes to calm the eyes. This lowers tension and improves blood flow. Then perform near-far focus with 10 reps, switching between 30-40 cm and a distant point, because alternating challenges both accommodation and vergence. Finally, do smooth tracking for 30 to 60 seconds to improve coordination. Make sure to breathe steadily and pause if discomfort rises. You finish by locking in lasting changes and checking results. Adjust screen brightness to 60 to 70% and position the top at eye level to reduce upward tilt, and wear corrective lenses as prescribed to restore clear focus. Schedule 20-minute breaks and perform short exercises during work to prevent relapse. If pain, persistent blurriness, or double vision continue after 24 to 48 hours, stop self-treatment and
Thanks for watching. Consider subscribing if we helped you.